Hi, good afternoon. My name is Marina Bolshinsky, and I'm going to be your nurse practitioner today. What's your name?
Amber Rosenthal.
Hi, Amber. What brings you in today?
Just a physical exam.
Okay, so first thing I'm going to do is I'm going to close the curtain for your privacy. Wash my hands. Okay, great. Amber, so you're here for a physical, great. Any current medical illness?
No.
Any past medical illness?
No.
Any family illness?
No.
Okay, any allergies?
Just seasonal.
Seasonal. Great. And any use of alcohol, drugs, or smoking?
No, never.
No. Great. Okay, but the first thing I'm going to do is I'm going to check your vital signs. Okay, wonderful. And your blood pressure is 123/60. Your heart rate is 62. Your respiration rate is 16 breaths per minute. Your O2 set is 100 on room air. And your temperature, 98.2. Very good vital signs. The first thing I would like to establish is your mental status. Okay, so I'm just going to say three words, and I'm going to have you repeat them in a little bit, okay? So if you could just say, remember red rose, blue ball, and basketball.
Okay.
Okay, great. So could you spell your name for me?
Amber.
Okay. And what brings you in today?
Physical.
Okay, and what did you have for dinner last night?
Spaghetti and meatballs.
Okay, wonderful. And what's today's date?
Today is Saturday, April 23rd.
And what season?
Spring.
And who's the president?
Barack Obama.
And can you repeat those three words I mentioned?
Sure. Red rose, a blue ball, and a basketball.
Wonderful. Okay, so excellent. So based on this, I can say that your ANO times 3, your memory is intact, both short-term and long-term, and you know where you are, you know what's going on, your speech is coherent, and your voice is nice and loud, it's not hoarse, your sentences, you're speaking full sentences and making sense. Okay, so now that we concluded your mental status, I can begin with my assessment. So I'm going to start by assessing your skin. So I'm taking a look at your skin, okay, and your skin is nice and pink, and there's no nevi, there's no lesions, there's no injuries, there's no any ecchymosis or anything like that, and the color is going with your ethnicity. And I'm just gonna feel, and it's nice and warm and not too dry, and you're not diaphoretic. And I'm gonna pinch for the torgo, and it bounces right back, indicating that you're not dehydrated. And I'm looking at your nails, and they're nice and smooth. And as I pinch down the skin, the blood returns right back to the nail bed. There's no clubbing. There's no clubbing, right? So the nails are normal, and based on the nails, I can say that you're not cyanotic. And just smile for me. Yeah, based on the mouth and gums and lips as well. So you're nice, and the color's nice and pink. Okay, moving on to your head. I'm gonna palpate your head, and it's nice, the phallic size. I'm looking at your skull, and there's nice hair distribution. The hair is nice and brown and thick and shiny and healthy looking. The hair is distributed evenly. There's no areas of missing hair, such as in alopecia. There's no areas of torn hair, broken hair. And the skull itself, there's no lesions and injury, or of course, there is no lice. And the skin as well as the hair appears to be healthy and shiny and normal. Moving on to your head, I'm looking at your face, and your face is symmetrical. You have a nice facial expression. And as I'm doing your face, I'm going to begin with the first cranial nerve that we will assess, which is cranial nerve number 7. With cranial nerve number 7, if I could just have you smile, if I could just have you frown, and blow your cheeks, and lift your eyebrows. Okay, and all these movements were done symmetrically. As you smiled, both parts of your face lifted at the same time. Everything is symmetrical, and basically I'm checking mostly for symmetry, which is what's the most important thing to me. So with cranial nerve number 7, I'm gonna assess the interior portion of your tongue. I will apply 3 different tastes, and if you could just identify them, if you could just close your eyes and stick your tongue out and tell me what you taste.
Salty. Sweet.
Yes, it is.
Bitter.
Okay, very good. So cranial nerve is 7 is intact. Moving on to cranial nerve number 5. I'm gonna start by palpating your face, palpating around the torgus area, palpating the TMJ. So if I could just have you bring your jaw down and close. Okay, my fingers fall right in front of your torgos. And as you pull your jaw down, the movement is nice and smooth. Move the jaw laterally. Okay, nice and smooth. I don't hear any clicks. I don't hear any pops. I don't feel any tenderness, and you don't have any pain.
Yep.
Okay, wonderful. So I'm just going to do a corneal reflex. If you just glance over there, as this touches underneath your eyes, you blink, and you blink again. Okay, very good. We're going to continue by having you identify what you feel. This is sharp, and this is dull. Okay, so I'm going to put this on your face.
Sharp, dull. Sharp, dull.
Okay, excellent. So that was cranial nerve number 5. Moving on from cranial nerve number 5 to your eyes. So I'm looking at your eyes, and they're nice and symmetrical with the same distance in between them. The eyes are not too close together and not too far apart. Starting with your eyebrows, they're nicely and symmetrical with nice hair distribution, no areas of alopecia. Continuing down to your eyelids, they are not swollen. There's no signs of edema. There's no signs of irritation or redness. And everything appears to be symmetrical. Your eyelashes are nice and thick and full with good hair distribution, both top and bottom eyelashes. Continuing with your eye, if you could just pull down on your lower eyelids, and I'm looking at your conjunctivitis, which is nice and thick. Your cornea is nice and wide, and there's no signs of jaundice. I'm looking at your sclera is nice and white, no sign of jaundice. I'm looking at the side of the cornea. It appears to be transparent and clear, and there's no signs of any lesions or injury to the cornea. I'm looking at your iris, and it's nice and brown and symmetrical in size in both eyes. Pupils appear to be symmetrical in size in both eyes. I will palpate the eyes a little bit, touching the inner and outer contus. Any pain?
Mm-mm.
Okay, pressing down on your tear ducts. Does not appear to be excessively teary. The eyes do appear to be moist. There's no sign of dryness, which is very good. With the eye, I'm going to continue by assessing the cranial nerves. So with cranial nerve number 2, I'm just going to have you read this chart. This is, I'm going to have you read this chart. This is the Rosenbaum chart at 16 inches away. So if you just read this,
LTFPH.
and if you occlude one eye and read it backwards,
HPFTL.
and if you occlude the other eye and read backwards,
HPFTL.
Okay, excellent. So the Rosenbaum test is similar to the Snellen test, and your score is 20/20, which indicates that at 20 feet away, which is the distance that you would stand in, and a normal eye could see 20. So that is your score, 20/20. Continuing with that, I'm just going to have you check your peripheral vision. Let me know if you can see my fingers.
See it.
Okay, I'm just going to close my eyes, and you're going to close yours and tell me when you see it. Okay, we see it at the same time.
See it.
Okay.
See it. Wait, sorry. See it.
Okay, beautiful. And cranial nerve number 2. Continuing with that, I'm going to test your pupil reflexes, cranial nerve number 3. So first I'm going to check for accommodation. If you just look right here, coming towards you, wonderful. So as the object was coming close to you, your eyes accommodated and your pupils constricted to help you see the object better. Coming from the side, okay, as the light was shining into your eye constricted, and so the eye that the light was not constricted into. Your eye constricted, and so did the eye that the light did not constrict into. Your pupils are about 3 millimeters in the left and 3 millimeters in the right. And again, I'm looking for symmetry, and this is what you have. So I'm going to say that it's Perla. Your eyes, your pupils are round, same in size, constricting and accommodating. Okay, very good. From then on, I'm going to continue by looking inside your eye. So if you just turn this way, we're going to do the ostomoscope. So I'm going to look inside your eye. Okay, so I'm going to bring the light towards your eye. I'm going to follow the red reflex. I'm going to look into your left eye with my left eye. So following the red reflex inside your eye, following into the eye. Very good. So as I'm inside your eye, I can see the optic disc. It's nice and kind of orange, creamy in size with borders are defined. I see veins and arteries. The veins are red and larger, where the arteries are lighter in color and thinner. closer towards your nose, I see the macula, which is a little bit darker in size. I see the cup, and the cup to disc ratio is approximately 2 to 1. I don't see any cotton wool area, any specific. The optic disc does not appear to be swollen or bulging out. Papilledema is not appearing. There's no signs of any redness or swelling or any inflammation going on inside the eye. I'm going to do the same thing for the other eye. Following the red reflex inside the eye. Okay, wonderful. Okay, and as I mentioned before, the optic disc, and the cup, 2 to 1. Closer to the nose is what I mentioned before. And there does not appear to be any bulging or swelling inside the eye. And now I'm going to check cranial nerve 3, 4, and 6, which is the gaze test. If you just please follow my finger. Okay, very good. So eyes are moving symmetrically, following the gaze. So all the movements were nice and smooth and symmetrical. So with that, the six cranial gaze test was done. If I'm going to do the cover test, please. I'm going to look into your eye. I'm going to look at your eye. Okay, wonderful. So I don't see any shaking. I don't see any nystagma. I don't see your eyelid drooping, ptosis, and I don't see any cross-eyeing. If I could see the other eye. Good. The eye is not shaking. The eyelid is not drooping. The eye is not wandering around. Very good. Okay, so we checked cranial nerve 2, 3, 4, and 6. Wonderful. Moving on to your nose. I'm looking at your nose, and it's nice and symmetrical and small and at the right anatomical position in your face. The same color, there's no discoloration as the nose, there's no redness or swelling, there's no excessive draining coming out of your nose, there's no ecchymosis or any signs of injury or lesions. As I'm palpating your nose, I feel that it's nice and smooth, the bone is nice and smooth, there's no swelling and no areas of tenderness. I'm going to look inside the nose now. Excuse me, I'm going to sneeze. Excuse me. Thank you. As I'm looking inside the nose, okay, so I see a little bit of hair, which is normal, and a little bit of secretions, which are going along with the fact that you have seasonal allergies. I don't see any blood or any injury or any polyps. I don't see any foreign bodies. I don't see a deviated septum. So no polyps. The nostrils are equal and symmetrical in size on both sides, and I'm looking at the other nostril. Again, hair, which is good. Some secretion. It's nice and light pink in coloration inside. Okay, continuing with the nose, I'm going to check cranial nerve number 1. So if I could just have you occlude one of your nostrils and with your eyes closed, identify the smell.
Coffee.
Yes, it is. And the other nostril.
Alcohol.
Yes, very good. Okay, and I'm just going to palpate for your sinuses, frontal and maxillary. Okay, very good. Continue. So we did the eyes and we did the nose, and now we can do the ears. So I'm looking at your ears, and they are symmetrical at perfect alignment on your face. Not that one ear is higher than the other. They're perfectly symmetrical. Okay, the skin of the ear does not appear there's any injury or lesions, redness or swelling. The color is consistent throughout the body, the same as the rest of your skin. As I'm palpating your skin, I'm palpating the torgus, any pain? The mastoid process, any pain? The pinna, the auricle, any pain? Okay, there's no lesions, there's no any inflammation or redness anywhere. Do you have any pain in your ear? Okay, so with that, I'm going to look inside the ear. So pulling the ear up and back, I'm looking inside the ear, and I see some hair and amber color, waxy serum protecting the ear canal. Going a little further, I see a tympanic membrane is intact, and I see the hand of malice and the cone of light shining back at me. There's no appear to be any lesions or injury or blood or any foreign substances. There's no fluids, and most important is that tympanic membrane is intact. Okay, checking the opposite ear. Okay, same thing. I'm pushing and pulling the ear up and back. The canal is protected by ear and serum, and the tympanic membrane is nice and pearly and white, the light shining back at me. Okay, very good. And now we will continue by testing the cranial nerve 8. And I just want to just double check that the microphone is on, if you don't mind. Is it on? Okay, wonderful. Thank you. We're going to continue with cranial nerve number 8. First thing I'm going to do is do the whisper test. So if I could have you occlude one of the ears, and I'm going to whisper, and you're just going to repeat back what I said.
1, 2, 3.
Excellent.
4, 5, 6.
Excellent. And now we're going to test the Weber test. So, where do you hear the sound?
Both sides?
Good. So the sound is equally heard in both sounds, literal in both sides. And we're going to continue with the Renin test. So I'm going to put this behind your ear. Let me know you can't hear anymore.
Stop. Stop.
And it's going to go in the mathoid process.
Stopped. Stop.
Okay, wonderful. So you were able to hear this when this was against your ear, which indicates that air conduction is longer than bone conduction, which is what we want to hear, which is a positive and correct test. So that was cranial nerve number 2. Moving on, I'm sorry, cranial nerve number 8. Moving on to your mouth. I'm going to assess your lips. And your lips are nice and moist and symmetrical. And if you smile, the smile is straight and not crooked. Their lips are not dry. I'm going to look inside the mouth. And the inside of the cheeks, the buccal mucosa is nice and pink and moist inside the mouth. There's no injury, there's no lesions, there's nothing abnormal inside the mouth. And now I'm going to continue by checking cranial nerve 9 and 10. If I could just have you stick out your tongue. Good. And as you're sticking out your tongue and say, the uvula is nice and centered. The soft palate is going up. Let me take a look at the hard palate. The hard palate is nice and intact. No injury, no lesions. The tonsils are at +1. They are not enlarged. They are not inflamed, and they're not in dark red color. They're nice pink color and moist. And if I just look underneath the tongue, okay, everything is nice and symmetrical and moist, no lesions. And if I just look at the teeth, nice and straight, white, straight, overbite, correct overbite, no missing teeth, no chipped teeth. The gums are nice and pink, no signs of gingivitis or any lesions or any disease on the gums. And if I'm just going to continue with cranial nerve 10, if I'm just going to elicit a gag reflex. Okay, wonderful gag reflex. The airway is protected correctly. The nerves are intact. Continuing with cranial nerve 9 and 10, I'm gonna test its flavor, your ability to recognize taste on the posterior of your tongue, posterior portion of the tongue. If you could please identify the taste.
Salty.
Yes.
Sweet. Bitter.
Okay, excellent. So you were able to identify correctly the flavors. That I placed is the posterior portion of your tongue. And continue with cranial nerve number 12. If you please stick out your tongue. Okay, wonderful. Tongue is nice and midline, nice and pink in color. There's no lesions or any abnormalities of the tongue. And if you just move it side to side. Okay, wonderful. And if you just press your face against my cheek. Okay, wonderful. Continue with cranial nerve number 11. If you just shrug your shoulders. And if you shrug your shoulders against my resistance. Okay, wonderful. We're going to continue with the assessment of your neck. So as I'm looking at your neck, I see slight pulsation from the carotid artery, which is normal. I don't. The neck is nice and thin. There is nothing bulging out. There is nothing abnormal. The skin is intact. I'm going to palpate for the trachea. The trachea is nice and centered, because if it was deviated to one of the sides, this could indicate some kind of lung problem, such as a lung collapse or anything that would make the trachea move to one side and the other. And yours is nice and centered. I'm going to palpate the thyroid gland, which is right here. If you just swallow for me. Good, and that was nice and smooth, okay? The thyroid is not swollen. And I'm going to palpate now your lymph nodes, okay? So preauricular, postauricular, tonsillar, submandibular, submaxillary, interior cervical, posterior cervical, deep cervical, infraclavicular, supraclavicular, occipital, inguinal, right here. Sorry. Thank you. Very good. Okay, so I did not feel the lymph nodes, and there was no tenderness. And if I was able to feel them, they should be like smaller than a pea, and should be able to be mobile. So very good. And that concludes my neck examination. I will now move on to your chest. So I'm going to look at your chest, and I'm assessing your ratio, and it's about 2 to 1. Okay, there's no barrel chest noted, no signs of emphysema, your breathing is non-labored, you're not using any accessory muscles, you're not using your abdominal muscles, you're not using pursed lips breathing, your color is nice and pink, your nails are not cyanotic, you're not in any respiratory distress. So the respiratory, as far as I can see, looks very good. Your nostrils are not enlarged, so you're not having any difficulty breathing. Now I will palpate any areas of tenderness. Okay?
None.
All right, wonderful. And then when you feel my arms against your chest, if you could just say 99.
99, 99, 99, 99, 99, 99.
Great, and I feel the vibration in both sides equally symmetrical. Okay, and that indicates that there is nothing occluding the air from moving around, such as fluids or blood, so or any other substance other than air. With that said, I'm going to continue by percussing your chest. Okay. So again, symmetrical testing, comparing each side to the other. Okay, nice resonant sounds. I'm going to check the back. Okay, and as I'm percussing, I'm going to test for something called diaphoretic exertion, and I'm going to pretty much assess your diaphragm actually going up and down as you take your breath. So if you just breathe normally, and as the tympanic sound changes to dull, this is where your diaphragm is, and now take a breath and hold it. Okay, so I'll mark those areas, and the distance is about 4 centimeters, which is normal, which is showing the diaphragm is actually going up and down as you breathe. Okay, I'm going to continue by listening to your lungs. Okay, as I'm listening to your sounds, the lung sounds are clear around your neck area. I hear some bronchial, going a little down, bronchiovesicular, and then vesicular sounds throughout the lungs. I don't hear any wheezing or any crackles. I'm going to do the same thing in the back. Okay, very good. Same thing, vesicular sounds, no wheezing and no crackles. And now every time I'm going to put my stethoscope against your chest, I would like you to whisper 1, 2, 3, which is the whisper test. And then I'm going to also do the agophony test, which I'm going to have you say E. Okay?
Okay. 1, 2, 3, E. 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 E. 1, 2, 3, E. 1, 2, 3, E. 1, 2, 3, E. 1, 2, 3, E. E.
Okay, wonderful. So as you were whispering 1, 2, 3, I could not hear that, and which is good, because if I was able to hear that, means that there's some kind of there's something in the lungs, such as fluid, that's making the sound able to be heard. And when you were saying E, I actually heard E, which is very good, because if there was any fluids or any fluids in the lungs or anything of such nature, I would hear E. So those conclude that there's just air, and it's good. And I'm just going to continue by testing your lung expansion. If you just take a deep breath. Okay, and as you're breathing, my thumbs were moving symmetrically with your breath. Okay, so with that, I can move on to my cardiac exam. So again, looking at you, I don't see, if you could just kind of lean back a little bit. Good. I don't see a JVP distension. JVD, okay. There's no distension in the jugular vein. Okay, very good. I don't see any pulsations. I'm just going to auscultate for subcutaneous emphysema. Okay, very good. I'm going to feel for some thrills and highs. Okay, very good. I don't feel any thrills. Okay, very good. And I'm just going to kind of envisioning where your heart is. Everything looks normal. The chest is rising up and down symmetrically. Don't appear to be in any distress. With that, I'm going to continue by listening to your heart. I'm going to listen to the aortic, pulmonic, tricuspid, and mitral area. Before I do that, I'm just going to test your pulses. So I'm going to, right here, the fifth intercostal space, which is the point of PMI, and I'm going to touch your radial. I'm just going to make sure that this is called the pulse deficit, that there's actually, the pulses are at the same time, and there's no pulse deficit. Okay, very good. With that said, radial, ulnar, brachial, carotid one side, carotid on the other. You never want to touch them at the same time. And femoral, dorsal pedia, dorsal pedia and post tibial. Okay, so your pulses are nice and strong. And now I can listen to your heart. So with my diaphragm, I'm going to listen to S1, S2, and with my bell pressing lightly, I'm going to listen to S3, S4, and murmurs, okay? So the second intercostal space is the aortic. I hear S1, S2, and with my bell, I don't hear an S3, I don't hear an S4, and I don't hear murmurs. Moving on to pulmonic, I hear an S1 and S2 with my bell. I don't hear an S3 and S4 and murmurs. Moving on to tricuspid. S1, S2 with my bell. No S3, no S4, and no murmurs. And with the mitral area, which is the fourth intercostal space right here, fifth intercostal space, I hear S1, S2, and I don't hear, with the bell, I don't hear any murmurs. And I don't hear an S3 and I don't hear an S4. And with my bell, I'm just going to listen to the carotid artery. If you hold your breath. No bruits. Hold your breath. No bruits. Okay, wonderful. And as I was listening to your heart in the aortic and pulmonic region, I was able to hear the S2 louder, and in the mitral area, I was able to hear the S1 louder. So, that concludes my cardiac exam. Moving down to my abdominal exam. Yeah, if you just please lay down. Okay. So I'm looking at your abdomen, and it's nice and flat. It is now distended. I see your ribs. The color is nice and pink. There's no veins. The umbilical area is nice and intact. There's no signs of infection or any signs of infection in the umbilical area. Yeah, if you could just check on the microphone. I'm sorry.
Sorry.
So sorry.
In the microphone, we were having microphone issues. Okay. It's working.
Okay, we're back. So the umbilical area is good, and there's no stretch marks or anything of that nature. I don't see any pulsations from where the aortic artery is. With that, I'm now going to listen to the abdomen, dividing the stomach into 4 regions, okay? So I'm going to listen in all 4 abdominal quadrants, the upper quadrants, the lower quadrant, and with my bell, I'm going to listen to the aorta. Great. No bruits. Okay, so vowel sounds are present in all 4 abdominal quadrants. Okay, continuing with my abdominal examination, I will percuss. Okay, and a nice tympanic sound, kind of like a drum. I'm going to percuss for the spleen. And if you take a breath. Okay, and as you can hear, the sound did not change from tympanic to dull, which is very good, which is what I want to hear, because if the sound changed into dull, that means that the spleen is enlarged. And because the spleen is under the ribs, I was not able to hear the sound change. This is called the splenic pressure sign, which is negative, okay? I'm now going to palpate for the spleen. So just take a breath in. Good, and I don't feel that as well. Okay, very good. And I don't want to feel the spleen, because if I do feel it, that means that it's enlarged. Continuing with my liver percussion, so I'm going to start down here. Okay, so right here the sound changes from dull, from tympanic to dull. I'm going to mark the area, coming back down. Okay, the sound changing to dull from tympanic. The distance between the two markings are about 5 centimeters, which is where your liver is, which is what I want to see. And I'm going to palpate for the liver. And I can kind of feel the edge of the liver right here where Amber's ribs are. And if you just take a breath in and let go, and if I palpate deep enough, I can kind of feel the end of the liver, the edge of the liver. Very good. So I'm going to continue with palpating in my 4 quadrants, soft palpations, so Amber gets used to my touch, and a little hard palpations. And I don't feel any hernias, any fluid, and any tenderness. Do you have any pain?
No.
Okay, and I don't feel the aorta. Okay, very good. And that's good. And that's my abdominal exam. And just one more thing, if you just sit up for me, please. I'm going to check the kidneys. I'm going to do the punch test. Any pain? Any pain?
No.
Okay, wonderful. We're going to continue with the test. We're going to continue with testing your gait, posture, range of motions, and reflexes. Okay, very good. So as I have you sitting here, if I could just take a look at your shoulder, I'm going to palpate the shoulders. Very good. I'm going to palpate the rotator cuff. Any pain?
No.
Okay, nice and smooth. Very good. Any pain?
No.
Okay. I'm going to palpate for the bicep tendon. Any pain?
No.
Okay. Continuing with the range of motion of the shoulder, if you just extend and flex, an internal rotation and external rotation. Okay. Any pain?
No.
Okay. Continuing with the elbow. I'm palpating the elbow. There's no signs of injury or swelling or any fluids anywhere. So if you just flex, extend, supination, pronation, very good. Continuing with the wrist, if you just flex, extend, hyperextend, radial rotation, ulnar rotation. Okay, very good. And with the fingers, if you could just flex, extend, adduction, abduction, finger to thumb, finger to thumb. I'm going to palpate the joints, the DIP, the PIP, and the CMP. Palpating for nodules, palpating each joint. Okay, nothing is swollen, nothing is tender. Very, very good. Okay, and with the neck, if you could just flex, extend, hyperextend, lateral rotation, and rotate. I'm sorry, lateral bend and rotate. Very good. And with the knee, palpating the knee, kind of testing to see if there's any fluid. No fluid. Okay. Any pain?
No.
Any tenderness? Okay. And if I could just have you bend, extend, internal rotation, external rotation. Okay. Wonderful. Moving on to the ankle and the toes. If I could just have you dorsal, planty, eversion, eversion, and kind of circular motion. Very good. With the toes, flex, extend, abduction, adduction. Okay, and I'm just going to palpate for the joints in the toes, the distal, DIP, the PIP, and the MCP. Okay, no swelling, and no tenderness noted. Very good. And as I have you in this seated position, I'm going to check your reflexes. Okay, so the knee. Again, testing everything bilaterally. The ankle. Okay, very good. The bicep, tricep, and the brachioradial. Okay, very good. I'm just going to do the Babinski. If you just lift your leg, inward J. Good. Your fingers didn't fan out, so it's a negative Babinski. Excellent. Negative Babinski. Excellent. And as I have you sitting here, we're going to continue with the sensory test. So I'm going to place an item in your hand, and I would like you to identify it with your eyes closed. It's called stereogenesis. Could you please identify the object?
Coin.
Very good. And identify the object?
Pen.
Pen. Very good. You're correct. We're going to continue by having you identify the senses. This is sharp and this is soft. Could you please identify what you're feeling?
Sharp. Dull. Sharp. Dull. Dull. Dull.
Okay, very good. And this is warm and this is cold.
Warm. Cold. Warm. Cold.
And if you could just, this is a little bit painful. If you could just tell me when you feel pain.
Feel it. Feel it. Feel it. Feel it.
Okay, excellent. And if you could just feel the vibrations and let me know when you feel it.
Feel it. Feel it. Feel it. Feel it.
Okay, excellent. And I'm going to continue by assessing your gait. So first I'm going to assess your posture. So your posture is nice and straight. Shoulders are straight. You have great posture. Okay, so we're going to continue with your gait.
Stand up.
Yes, please stand up. And if we can have you walk to the camera. And if you please walk back on your tippy toes. And on your heels. Okay, good. And if I could just have you close your eyes and stick your hands out. Okay, and I'm just going to push down and your hand goes back up. You're not swaying side to side. You're not losing your balance. And if I just, that is the drift test. And if I could have you just, we're going to test the Romberg test. Okay, and you're not swaying side to side. You're not losing your balance. If you just do finger to nose. Excellent. And if you just do your foot against the heel. Okay, and your posture is nice, your balance is nice. As you were walking, your hands were swinging back and forth, one foot in front of the other. There appears to be no difficulty with posture. And if I could just take a look at your hips, and they're nice and leveled, symmetrical. It's not that one hip is higher than the other. Perfect. And we'll just do some hip range of motion. If you just please flex, extend, hyperextend, same flex, extend, hyperextend, and internal rotation, external rotation, adduction, abduction, adduction, abduction. Very good. Thank you. And as I have you standing here, if I could just have you turn around, I'm going to take a look at your spine. If you just bend slightly forward. I'm checking the spine for scoliosis. I don't see any lordosis, which is the bottom portion of the spine. I don't see kyphosis, which is the higher part of the spine. I don't see any spine sticking out. I don't see any swelling. I don't see any indications of any inflammation. Do you have any pain?
No.
And we'll do some range of motion for the spine. If you just flex, very good, extend, hyperextend, lateral rotation, and if we just rotation. Okay, very good. So your gait is nice and straight, your posture is straight, your memory is intact, your cranial nerves are intact, your head to toe assessment is great. Everything appears to be normal. Thank you.
Thank you very much.